Autism. Autism is a brain developmental disorder characterized by impaired social interaction and communication, by restrictive and repetitive behaviors. Leo Kanner introduced the label early infantile autism in around 1943. The autism first appears during the infancy or childhood period. It follows the steady course without the remission. The prevalence of autism. There are around 2 to 6 cases per thousand population. The rate of autism is growing at around 10 to 17% per year, and the male is to female ratio is around 4:1. It is usually identified before the age of 30 months. There is no racial or socio-economic differences. What does autism really mean? Autism causes the kids to experience the world differently from the way most other kids do. It's hard for kids with autism to talk with other people and express themselves using the words. Kids who have autism usually keep to themselves, and many can't communicate without the special help. They also may react to what's going on around them in unusual ways. The normal sounds may really bother someone with autism, so much so that the person covers his or her ears. Being touched, even in a gentle way, may feel uncomfortable. Kids with autism often can't make connections that other kids can easily make. For example, when someone smiles, you know the smiling person is happy or being friendly. But a kid with autism may have trouble connecting that smile with the person's happy feelings. A kid who has autism also has the trouble linking words to their meanings. Imagine trying to understand what your mom is saying if you didn't know what her words really mean. Autism causes kids to act in the unusual ways. They might flap their hands, say certain words over and over, have temper tantrums, or play only with one particular toy. Most kids with autism don't like changes in the routines. They like to stay on a schedule that is always the same. They also may insist that the toys or the other objects may arrange a certain way and get upset if these items are moved or disturbed. The brain contains over 100 billion nerve cells called the neurons. Each neuron have hundreds or thousands of connections that carry message to the other nerve cells in the brain or the body. The connections and the chemical messengers they send, called the neurotransmitters, let the neuron that help you see, feel, move, remember and work together as they should. For some reason, some of the cells and connection in the brain of a kid with autism, especially those that affect the communication, emotion and the senses, don't develop properly or get damaged. The autism consists of triad of symptoms. Triad consists of impairment in the social interaction, impairment in the communication, and restricted interest and the repetitive behaviors. In the social development, the child shows less attention to the smile and look at others. There is less eye contact. Making and maintaining friendship often proves difficult. Many children show severe tantrums and aggressive behavior. In the communications part, they do not develop enough natural speech. The delayed onset of babbling is there, unusual gestures are present, diminished responsiveness with caregivers, and echolalia made present. In the repetitive behavior, stereotypy, arrange object in a stack or the lines, sameness is resistance to the sameness when resistance to the change, restrictive behavior and self-injury. Treatment of autism. There is no cure for autism, but doctors, therapists, and special teachers can help kids with autism overcome or adjust to the many difficulties. The earlier a kid starts treatment for autism, the better it is. Different kids need different kinds of help, but learning how to communicate is always an important first step. Spoken language can be hard for kids with autism to learn. Most understand words better by seeing them, so therapists teach them how to communicate by pointing or using pictures or sign language. That makes learning other things easier, and eventually, many kids with autism learn to talk. Therapists also help kids learn social skills such as how to greet people, wait for a turn, and follow the directions. Some kids need special help with living skills like brushing teeth or making a bed. Others have trouble sitting still or controlling their tempers and need therapy to help control their behavior. Some kids take medications to help their mood and behavior, but there's no medicine that makes a kid's autism go away. Students with mild autism sometimes can go to regular school, but most kids with autism need calmer, more orderly surroundings. They also need teachers trained to understand the problems they have with communication and learning. They may learn at home or in special classes at public or private schools. Some kids with mild autism will grow up and be able to live on their own. Those with more serious problems will always need some kind of a help. But all kids with autism have bright futures when they have the support and understanding of the doctors, teachers, caregivers, parents, brothers, sisters, and friends. Some strategies for the family to cope up with the child with autism are as follows: to develop a consistent structure or the routine, to prepare the child for change in routine, to consider different form of communication other than talking. Also looking for environmental stimuli or warning sign that precede the major behavioral outburst. Not expecting your child to tolerate new people or the group situations, and becoming aware of the unpleasant situations and sensations as well. There are different misconceptions about the autism. These are: children with autism do not talk. Children with autism cannot show affection. Children with autism never make eye contact. Within inside, a child with autism is a genius. Bad parenting causes autism. Thank you. Please do like, subscribe my channel and share this video.